Welcome to the Global Medical Device Podcast, where today's brightest minds in the medical device industry go to get their most useful and actionable insider knowledge direct from some of the world's leading medical device experts and companies.
One of the things that makes Greenlight Guru unique is what we call our Guru Edge. And more specifically, we have a whole team of people, medical device gurus, who have a ton of industry experience prior to joining Greenlight Guru. And I thought we would try something a little bit different on the Global Medical Device Podcast. I thought we would feature some of our gurus and let you know a little bit about who they are and their background and how they work with customers and medical device companies all over the globe. So enjoy this episode of the Global Medical Device Podcast. Hello and welcome to another episode of the Global Medical Device Podcast. This is your host, founder, and VP of Quality and Regulatory at Greenlight Guru, Jon Speer, and excited to have this episode. This one means a lot to me, and we'll get into it for sure. But this is one of our. I decided to do a twist here on the Global Medical Device Podcast. We have at Greenlight a lot of amazing people, and some of the folks that are near and dear to me at Greenlight Guru are some of our medical device gurus. And joining me on this episode of the Global Medical Device Podcast is Senior Medical Device Guru at Greenlight Guru. That's a mouthful. Jesseca Lyons. So Jesseca, welcome.
Hey, thanks to be here.
I think as I was saying that, I remember you and I did a podcast way back, right?
Yeah, when I first started, it was, I think, like 3 weeks into it.
Yeah, I was like, here, we're going to do this. And you're like, what? So I wanted to highlight some of the amazing expertise that we have in-house at Greenlight. I mean, folks listening probably are aware of the Greenlight Guru medical device QMS software. To me, what makes, and that's special, but to me, what makes Greenlight really special is folks like you. You've been in the medical device industry for a while now, and you get to work with companies all over the globe. But I guess before we dive too deep into the conversation, I guess give folks a little bit of a background of who you are and what you're all about.
I am a design control junkie when it comes down to it. But long story short, so I'm a mechanical engineer from Rose-Hulman, and I got started in kind of design and development activities at big company at Beckman Coulter, working in the custom integration group. And I realized working with them just how important it was to think about, the entire system and all of the different pieces and parts as a whole when going through and thinking about design controls and understanding kind of how everything all fits together and traces through. And then from there, realizing that what I was missing out the most on was actually getting connected to customers. So I took a shot at consulting and realized that was definitely not something that I wanted to go through and do, mainly because I didn't get a chance to stay in the medical device industry with that consulting experience. The little bits of med device that I got through that were just so rewarding. I realized how much I was missing being in this field. So started working then at a contract manufacturer. So I got a chance to see all of the beginning at Beckman with design controls, and then moving into contract manufacturing and supply chain, seeing that side of things. So kind of seeing the beginning and end until paths crossed again. And you and I ended up together at Greenlight, helping out all of our customers there.
Yeah, and I remember the day that, we see Greenlight had been around, I think at this point for about 1.5 years or so. And we were growing like crazy, and we had not officially started or formed a group called Customer Success yet, but it was something that we were doing. And I remember calling you because our paths crossed where you were at Beckman. I was doing some consulting and got to learn a little bit more about you and how you're wired. And all right, log this in the memory bank. Jessica's a person to stay in contact with over the next several years, and And I know you were at a company too that you'd come in and looked at Greenlight.
Hmm.
And I was like, oh yeah, let's call her because we're growing like crazy, and what our customers need and what she's passionate about line up. And I remember that. I know you do, or I suspect you do. But do you remember the day you came in for the interview on site?
Yep, I do.
Here's my recollection of it. I guess you can put your perspective on it too. But my recollection is that I was on a call with a customer. I remember the customer. We'll leave his name out of it for the moment. But he started asking me all these questions about statistical, because you're concerned. They're like, Jon, I'll come in and meet with you, but I like being an engineer.
Yep.
Oh, you'll be an engineer. And like, you're like, I don't know. And then you came in and I'm talking to this customer and he started asking questions about statistical sample size and how to do that and that sort of thing. And I'm just literally handed you the phone, like he's asking questions that are right up your alley. And then that's my recollection. I don't know if your story varies from that or not.
No, it's very similar. I'm sitting here scribbling you notes on, don't forget to tell him about this and tell him about that. And you finally got sick of reading my scribble as I was passing it back and forth and said, look, just talk to him yourself. And actually it was that customer that made me realize that I needed to be involved with Greenlight and needed to be able to help customers exactly like them.
Yeah. And from then until now, I mean, I lost track of how many customers you've gotten to work with, but it's quite a few.
It is. And that's the great thing is that we just have so many customers who are like that, wanting to understand, wanting to dive in, wanting to understand how everything works.
This is the thing that sometimes, I don't know if it gets lost, but I don't know if it's clear to the outside observer evaluating Greenlight. This is something that makes our company special. And again, I have a bias and you have a bias, but the fact that all of our customers get this white gloves treatment, and if they need help from med device nerds or design control nerds or quality system nerds, we've got people that this is what they did in their career before coming to Greenlight. So to me, that's really awesome. And I guess I'm kind of rambling a little bit, but I guess share some of the things that you enjoy about being one of the medical device gurus at Greenlight.
I think one of my favorite things is just all of the different types of devices and ideas that we get a chance to interact with. I mean, there's absolutely no way at any other company that I would have gotten the opportunity to work on so many different types of devices. Going through and working on software as a med device, working on, devices for airway, for, infant care, pediatrics, orthopedics, surgery, you name it. We've covered just about every category of devices. And I think this is the only place where I would really get that chance.
Yeah, and I know this next thing that I'm going to ask you is, I suspect it might be a little bit challenging for you to give just one, but maybe share a few of your favorite customer stories that you've been a part of over the past, 4.5 years.
I know. Well, like you said, there are so many that I don't know that I can pick exactly my favorite, but top ones, I think probably one of my favorite ones is a customer that I've been working with for a really long time now. When they went through an audit for the first time. They had never been through any kind of audit experience at this company, at any other company that anyone had been a part of. So the team was brand new to this. So they're brand new to med device. They're brand new to going through an audit. And they were like terrified, as many of us who have even been through audits are. You just never know how this is going to go. And you want to be on like your best behavior. And you go through, I don't know how many dress rehearsals. And they spent so much time just prepping and trying to make sure that they would be right. And we had practice interviews and do's and don'ts and tips and tricks and how to do this. And on the day that they got through it, they hadn't even heard yet whether they had successfully completed everything, like gotten their certificate. But the day that they finished the audit, they gave me a call and they're like, Jesseca, you would be so proud of me. I did such a great job. This was awesome. And it was just how excited they were about how they had done. Just, you had to smile. Like, it was so awesome to hear that.
Yeah, that's cool. And I think that's one of the things for me, that's really rewarding. I guess prior to Greenlight, or even for a long time, I even go back probably. I was probably a med device engineer for probably a year and a half before it really clicked for me. And the moment that it clicked, it was clear. It was like, my mission is to improve the quality of life. And being involved with this industry and designing and developing products and bringing these products to market, I have an influence on that. And that's really important to me. And, fast forward several years later, when I was doing consulting on my own, I was able to work with a lot of companies, maybe, a couple dozen companies, maybe more than that. I lost track, frankly, but that's a really rewarding experience. And then fast forward a little bit further yet still, but in the Greenlight era, today we have an opportunity to work with and help hundreds and hundreds of medical device companies all over the world. And I mean, what does that feel like?
It is the best feeling in the entire world because, like you said, there's something so incredible about being able to help improve the quality of life. And I guess the thing for me is that quality of life isn't just for, the patients that these devices will impact, not for the families of those patients, but it's also the engineers who are working on them, anybody in quality, manufacturing. I mean, I don't care who you are, bringing a device to market, that's really hard and challenging because of all of the rules, regulations, documents, complexity behind it. And, we can always make life significantly more complicated, based off of other experiences than it has to be. And to be able to improve the quality of life for bringing the device to market for the patients and everybody who uses it, it's so cool to get to have that opportunity. And what's more is it doesn't stop there because it's not just helping, our customers, it's when they go out and they talk to somebody else and share. I mean, this is why we put on all of those, webinars and training things that we do, the virtual summit that we just did. It's actually getting people to realize the intent behind all of the regulations and to do the right thing. And it keeps spreading. So, I mean, at some point, I feel like I get the opportunity to impact everyone's life, whether they're our customers or not. I feel like that it's just always spreading to improve everyone's quality.
Yeah, I hadn't thought of it like that. I guess I had always kind of thought about it from the customers that we work with, but it's a really good point. I mean, the content, the webinars, you mentioned the virtual summit that happened recently. Just that virtual summit alone had like 5,000 participants in it. And I know some of our content has been consumed hundreds of thousands of times. So that's a really good point I hadn't thought of. I appreciate you sharing that. You talked about being a design control nerd. I mean, I can relate to that. I mean, you and I, we can talk about design controls for days. But for you, why do you think you are that design control nerd? Or why does that topic resonate so much with you?
So the nice way of putting it is I am a type A personality. I am very precise, very analytical. And what I love about design controls is that I get to be precise. I get to be analytical. I get to tell people what to do. If it's written down as a design control, you have to do it. But I get to have control over making sure that what I think is going to be the best option, what I think is going to be the right thing to do, that's what gets done. There's no mistaking it because it's very clear. It's explicit.
All right. Well, tell me more about that because, there might be some folks listening here. I mean, let me, I guess, give a little bit more context. So I remember earlier in my career where a lot of engineers, and I think this might be conventional wisdom with a lot of folks out there even today, but I remember a lot of engineers would resist the idea of design controls and almost like their perception was that design controls were just busy work that impeded their progress.
Mm-hmm. Yeah. Why do I have to write it down? I'm an engineer. Right. I don't need documentation. That's quality's job. Yeah. I get that.
Well, I mean, I'll hear somebody, today say something like, I don't like design controls. It's too much paperwork. It's too much of a burden. And my reaction is if that's how you feel, well, I get that, but maybe you have the wrong approach,
Mm-hmm. Well, and I think that's the thing is that a lot of engineers, we think that design controls are too restrictive, that, I can't really design. I can't be an engineer if I have to do this. And I think that that's part of why people don't like design controls.
Yeah, I know. I mean, I'm sort of of the mind these days. The documentation is important. The cliche, if it's not documented, it didn't happen, and that sort of thing. To me, like design controls and the documentation piece aside, I mean, it's a rare day that one person will be involved in the design and development of that device.
Mm-hmm. Teams change frequently, whether that's because new devices are coming out or people are changing jobs in the middle of a project launch. I mean, there's a lot of different reasons why your team is going to change.
Yeah. And then I think my goal of designing and developing a medical device is to get it to market, right? And, as soon as you get something to market, there's a pretty good chance, like almost 100% chance that somewhere in that product's life cycle, there's going to be a change. So if it wasn't written down, how do you know what the change is and if the change is good or bad and that sort of thing? It's just, to me, hopefully folks are getting beyond this point where they realize, oh yeah, this is important stuff.
Yeah. For a friend of mine, it clicked when they went to a new job and they were basically tasked with, not in the med device industry, but tasked with going through and creating all of the design control documentation for all of this legacy product because they were making changes and somebody had asked for some testing and they had absolutely nothing, no history on it. So they even had to go back and redo all of the drawings based off of measurements in order to get to a new supplier. I mean, like, there's a lot more impact than people seem to want to acknowledge up front from design controls not being documented or not done well.
The last comment reminds me of conversations I've had with a gentleman by the name of Devin Campbell with product. And I think he says it very well. He's like, well, when you enter into a project, don't look the 6 inches in front of you. Think about the end goal. Where do you want to be and what's going to happen with this thing? And then shape your processes and your practices with that end goal in mind. I'm sure you have, and I know I have, worked on design history file remediation projects. And I think this sort of thing is what drove me to eventually start Greenlight Guru a handful of years ago. I started doing low or no value add activities and busy work, if you will. And there's nothing in my mind that is more busy work than documenting design controls after the fact. I mean, that is such a pain.
Well, and there's also nothing more guaranteed to end up incorrect than going through and trying to document it all after the fact. Especially if you didn't originally do it, you're going to miss like that one key critical design input that has to be there in order for the whole thing to work. And you're going to end up making a change to it and, never being able to pass testing because you can't figure out, well, we made this tiny change. It shouldn't be a big deal.
Yeah. I don't know where you stand on this topic today. I know where you used to stand on it a few years ago, but I guess speak a little bit about risk management.
Oh, yeah. So oddly enough, I guess not oddly enough, I hated risk management at one point in time. And it's one of those things that I think most people hate risk management until you can go through and, to me, actually figure out the root of what we're doing here with it. I think we all agree nobody wants to hurt anybody with the devices we develop. Nobody wants to cause any harm. But man, we've all sat in those meetings. They are hours upon hours, days upon days. And at the end of it, you are cross-eyed from looking at a spreadsheet and merging cell after cell. And who doesn't hate that?
Well, I mean, more than that. I mean, if you've ever sat in one of those meetings, maybe the first hour, 2 hours or so, it might be good conversation. It might be meaningful value add. But by the time you get toward the tail end of one of those things, people are checked out. It is not a good exercise.
You're sitting there yeah, whatever he said, go for it. Fine. That's an okay probability.
I mean,
you stop actually caring about it. Or my favorite is, well, that could never happen. Never in a million years. Why are we even considering it? Well, because mod database for our predicate says that this happened. Well, yeah, I guess you could, but the percentage is so small. It would never be there. We shouldn't even consider it. You get in a theoretical argument, so it's just, I hated risk.
Yeah. Well, how do you feel about it today? Or maybe what tips or pointers can you share with those listening to to embrace risk as something that's important?
Risk now is actually a lot of fun. So I don't know if it was just like I saw a better way to do it. I mean, I remember that first day when I was interviewing and you were showing one of the customers how to use risk management, and I'm watching and learning, and I'm like, oh, well, that makes sense. Like it just like all of a sudden opened my eyes, and I realized that instead of trying to figure out things with FMEA and, well, is it the mode and is it the effect and is it a cause of a mode, and like I couldn't figure out half the words, let alone what went where and when. But to just think about it in terms of actual the standard, and look at what 14971 says, and figure out in plain English, a foreseeable event and a hazardous situation. Like all of a sudden, okay, this started to make a lot more sense. And then I realized we could have a lot of fun with risk.
Yeah.
And so now we start doing examples. Like I've been on calls with customers where in order to figure out like probability, we talk about like ice cream. So like if you got an ice cream cone every hour, like would that feel really frequent? Or if you got one like, once a day, is that a frequent number of ice creams? Well, maybe you go get one, once every 10 years. Is that, improbable that you're going to end up with ice cream? And so we take out harm and we take out, risk, and we think about it in a lot more fun, relatable terms. I mean, no one's going to turn down ice cream. And all of a sudden now we've shifted the conversation, and it's a lot easier. It's a lot more lighthearted. I know we did one conversation about Sharknadoes on figuring out foreseeable events and hazardous situations and how to tell if it's an event or a situation. I mean, like we have so much fun. And by stripping it to that level and by interjecting a lot more joy into it, all of a sudden people now, again, we spark the passion and risk. And it's like, oh, like this is important. And this is something that we should do, and it's not so intimidating. And honestly, I have to actually credit David Moore with his risk example as to why I started thinking about it in more fun terms to explain it to people.
I'll come back to the David Moore, but clearly you're having more fun than I am talking about risk. I haven't heard the ice cream or Sharknado story before.
Yeah, no, we have a ton of fun. That was actually that was a couple weeks ago that we did a couple days ago that we did ice cream for figuring out probabilities. And I guess people got really intimidated on this whole quantitative versus qualitative when it came to how we figure out the probability of something. And do I actually know what percentage or how many devices? Can I put it in a percent? Do I have to use words? I mean, it was so complicated, and no one could agree on what it meant or how often it would occur. And so we tried to go back to the basics. And at the end of the call, I think all of us were laughing, for one, and two, we all understood what it meant to occur frequently versus being improbable.
Mm-hmm. And when you said Sharknado, I instantly started becoming an engineer and super analytical. I'm like, are you talking about Sharknado as an event or Sharknado as a movie? Because if it's as an event, it's highly improbable. But if it's as a movie, didn't they make 3 of those things?
Yeah, so they made the movie. So if we're taking a look at Sharknadoes, like from all of this, what would happen if we had the situation of the sharks in the tornado, and what would the harm be? Well, I mean, you could get hurt by the shark, or you could get hurt by the tornado. And so we've got a lot of different ways. And,
interesting.
What kind of events would lead to the sharks being in the tornado? Well, we'd have to have the tornado and shark-infested water. I mean, like we literally, we went down this whole thing, and it made risk a lot more fun.
All right, folks, you heard it here first. When you're dealing with risks, consider using ice cream and Sharknadoes as examples to keep it a little bit more lighthearted. But I want to come back to the David Moore comment. And folks, I'll see if I can find that link and share it in the text that accompanies this podcast. But he has a good way of describing things. And he was talking about food rotting in a refrigerator, and he was making the case, because I think a lot of people are still stuck in this FMEA land. And there's a point in time for FMEA. But my opinion is that's not the first place you start from a risk assessment standpoint. You have to understand what's going to happen with this product and how is it going to be used. And you have to consider not only failure modes, but normal use, because these are medical devices going into the body. So I think it's really important for people to sort of reprogram themselves. And I'm I'm old enough to remember before 14971, and I'm old enough to remember that risk management was just something that we did as part of the design and development process. That's why the whole design control process in and of itself is a risk-based approach to good design practices.
Yeah. And I think that's part of it, is that risk and design controls, they go hand in hand. And I think another reason why people don't really like, risk management as well is because it feels almost like, well, I've already done all of this. Like, I already designed my device to be safe. I already, eliminated all of these things. I keep getting told, well, there's good design practices. So we design around pinch points and put covers in place. And so why do we have to think about all of these things? Why do we have to document them? And I think some of it is because we all think about risk from, growing up from engineering school, the FMEA world. And, we're thinking about, after I have this device made, what are some of those failures? What could go wrong? But if we start it from the very beginning, before I even know what this device is going to look like, well, now all of a sudden it makes it a lot easier. It makes a lot more sense. And, well, I don't want somebody to get pinched, so I will put a cover on. Let me get credit for the work I did there and put in that as our risk controls.
Yeah, that's a really good point. All right, so folks listening to this, I'm sure there's some customers listening to it, and I'm sure there's a lot of folks who aren't Greenlight Guru customers. I guess we'll start first with those who may just be consuming Greenlight content, and that's great, because to your point earlier, this is why we do this. Of course we have software and it's great and all that sort of thing, but bigger picture is we are trying to help an industry provide information, tips, pointers, so that all medical device companies can be successful in their endeavors. For those that maybe aren't necessarily interested in Greenlight or aren't at that point where they've implemented Greenlight Guru, what are some tips and pointers that you can think of or suggest that can help them be successful?
So one of the things is, like I mentioned about risk, starting early, so no matter what it is, whether it's, design controls, risk management, just general documentation, like, it never hurts to start putting some thoughts down on paper, starting to try to figure these things out early. You don't have to always keep what you started with. Like, that's the big thing, is everybody seems really terrified to start putting things down on paper. That makes it official. And what if I change my mind? And good. We should change our mind. Like, we should go through it. And that's the design process. That's how we iterate. That's how we grow and learn. But tip for success is to put it all down on paper early, knowing that you're going to iterate on it, so that, one, you can figure out what's actually going to work, what isn't. And two, you don't lose sight or lose track of something down the road. Or worse yet, end up so busy that you have to retroactively try to create these things. Because let's face it, no one has the time for that.
Yeah, and I think this is where people get stuck, right? Because they're hesitant to document something because they know it's going to iterate and change. To me, that's like exactly the time to start doing that, so that I can capture my thought. And I think when people think of design control, sometimes they think of it as this rigid thing. It's like, no, it's not intended to be that way. Not intended to be that way at all. It's a really good tip.
They worry that they're going to have to go through their engineering change order process. Like, I mean, if you haven't done a design review on it yet, just keep changing it, move on, try again, and learn from your prototypes. So, go through and figure out your user needs, design inputs. You probably really already know what those are if you're working on prototypes. I mean, otherwise, how are you creating a prototype if you don't know what you're making? But if you can go through and learn from that and make the tweaks and adjustments, don't be afraid to put to be determined in as a requirement. Circle back and make those changes later.
Yeah. All right, so let's change the context a little bit. Similar question, but your customer just signs with Greenlight and you're going to be working with them. What are maybe a couple of tips and pointers that you can provide this new customer to gain the most out of their Greenlight experience?
In order to gain the most out of your Greenlight experience, ask questions. please reach out to us at any point in time that you get stuck. There's absolutely nothing that we love more than getting a chance to answer questions, whether it's philosophy on design controls, how do I title documents? What are some best practices for using workflows in the system? Doesn't matter what it is. Ask as many questions as you want. That's what we're here for. And that's how you're going to be the most successful. And take advantage of our Help Center content. There's some great articles in there with tips and tricks and best practices that other customers have implemented. Get a leg up, a different starting point than what they had, by using all of their knowledge to get started.
Yeah, that's great. Great advice. One of the reasons I wanted to feature and highlight you and the other gurus on the Global Medical Device podcast is to emphasize, I guess, to those listening that the Greenlight experience, for me anyway, is the customers who get the most out of the relationship is when we connect at the human level. Mm-hmm. And, of course we have software, and of course you can use the software and never talk to anybody at Greenlight. But, we love and care about improving that quality of life. I mean, that truly is our mission at Greenlight, and everyone at the company connects with that because, we all have loved ones or in some cases our own selves are going through some sort of medical procedure where these products that customers or those consuming content are designing and developing and manufacturing. The human element is really important. And I know that you work really, really hard connecting at a human level with our customers. And I appreciate that a great deal. For those listening, and maybe be a little bit vulnerable here. I know I'm catching you off guard with this one, but what is something that someone may not know about you? What is something that they don't know about Jesseca Lyons that people can relate to you as a human?
So, obviously, we can stick to the light stuff if we wanted to say that I love dark chocolate, a good book, reading all of this. But if we're going to take it to that next level and really connect as humans, I guess one of the things that some of our customers know, the ones that I work with a lot more regularly, is that I really, truly take all of their successes and failures to heart. And when they get the concept, like the audit, when they went through that successfully, I cheered just as loudly for them as they did for themselves. Like there was nothing like it that day to hear how proud they were of what they had done. And that for me is the best part of this, is getting to have so many successes and okay, yeah, we're all going to have that failure. You're going to not make it past the refuse to accept period with your 510K. Like you're going to get that rejection. You're going to have to go back and answer more questions, or testing is going to fail. And I take that to heart too. I don't want you to have to go through those failures. I'm going to try to warn you if I can, if I know of things being, gotchas or things to keep an eye on. But I'm going to take it just as hard as you do when you don't get through those hurdles. So for the customers who work with me a lot, they know just how much I take it personally, how much I care about, what's going on with them and where they're at, and the good, the bad, the ugly with it. But those who haven't worked with me or those who don't work with Greenlight at all may not know just how much we care, just how much I care.
Yeah, I can attest that, well, when we're in the office, you always know when something exciting has happened for a customer, because Jesseca is literally like cheering out loud, and everybody in the office sort of stops and comes over, and then she gets this awesome opportunity to share the customer success, their major milestone that they achieve. So she does care a great deal about that. I talk a lot about, this, but at Greenlight, that the heartbeat of our company is our customer success team. And I look at you as the heartbeat of that customer success team, because your energy is so contagious, and your enthusiasm. When you exude that, everyone on the team feels that. And I think because of that, we, and I mean this, you and me, we've built a really awesome team.
Yeah.
And of course, I got to extend that to the rest of the team too. It's the best team I've ever worked with, ever. and
Oh,
22 plus years of working professionally. I've never had a team experience like this.
by far. And I mean, the whole team is so amazing in what we accomplish, the challenges that we help people overcome, the challenges are internal, external, it doesn't matter. I mean, it's just, I'm in awe every day of what the team does.
Yeah, it's truly a special group of people. And thank you so much for taking a few minutes to share some of your insights and your experiences on this podcast episode. And folks, there's going to be other episodes with other gurus. So, you'll be able to hopefully feel a little bit of that human connection with some of the Greenlight team members. And certainly if you're curious about the whole experience, the medical device quality management system that's designed specifically for the medical device industry by actual medical device professionals. That's right. I've been in this industry for 22 years. Jesseca, I always forget. I always add years to your experience. But how long have you been in the industry?
Oh man! So I stopped counting a long time ago, right? We always say, so 10 to 15. I mean, honestly, I can never remember. We'll go with that.
All right.
I will always forever be this range, by the way.
Yes,
We're ageless in this industry.
She's ageless these days. But all of our gurus, they've all been in this space. So I forget the total number, but it's something like over 100 years of experience across all of the gurus. We're all involved in the design and development of the Greenlight platform. So as new features are being rolled out, we're involved in that, and our team stays connected to the changing quality and regulatory matters, whether it's EU MDR or MDSAP or whatever, 14971 or whatever other changes. So that's something that makes Greenlight Guru unique. So if you're interested in learning more about that, I would encourage you to go to www.greenlight.guru, and a lot of content there. But if you want to have a conversation, just connect with us, and we'd be thrilled to have that conversation with you. Again, let me thank Jesseca Lyons, Senior Medical Device Guru with Greenlight Guru, for being my guest on the Global Medical Device Podcast. And as always, this is your host, founder, and VP of Quality and Regulatory at Greenlight Guru, Jon Speer, and you have been listening to the Global Medical Device Podcast.